Libbie Wallace, it's so lovely to have you here today. I've actually visited you at your salon, at your clinic, haven't I?
Yes, you have
So
to.
do tell me all about it.
So my clinic's in Harley Street, and I mainly do injectables there, mostly dermal fillers, Botox, skin boosters, biofiller, and some other facial treatments as well.
Wonderful. Because I actually met one of your clients.
Yes.
Who was absolutely raving about you,
Oh,
saying that she wouldn't go anywhere else.
Yes.
So I want to know, how did it all begin? How did you get into this amazing industry?
So I got into aesthetics in 2012, and my background, I was a cardiac surgical assistant, and I was effectively made redundant. I had to decide then what I wanted to do, and I thought back in my previous years in Australia, I worked for a cosmetic surgeon, and I absolutely loved it. I've always been interested in skin, so I decided at that moment to change, and that's how I ended up in aesthetics.
Wonderful. So now you're here and you're doing so many amazing things. Tell us actually the most exciting thing that's happening at the moment in your industry.
The most exciting thing for me at the moment is the biofiller for me, because it gives people an option to do something that's very natural. They're not going to be allergic to it, and it's not going to give them a result that they don't recognise their face. It's a very subtle improvement, and I quite like that.
So tell me, if I was having having one of these biotreatments, what happens? What is the sort of journey that I would go through, and how would you? What would you say I needed, and how would you say you were going to carry on with it?
So first of all, it all starts with a consultation. So you come in, you discuss your needs, and we go through your medical history, because some people aren't appropriate for these treatments.
Like what?
So if you were having blood thinners like warfarin or clopidogrel, it affects your platelets, and it wouldn't be appropriate. It just would not work. If you've got lots of other comorbidities, say, you've got heart issues, kidney issues, your body isn't going to respond as well as someone who is healthy and optimized.
And does that mean I couldn't have it if I had those?
You wouldn't get a result. It's not that we would refuse you on the fact that, say, you can't have it, but you're not going to get a result from it. So we would say it's not worth the money.
And can you tell me why? Why I wouldn't get a result for it?
Because your body wouldn't respond to the treatment.
Right, OK. No, so it's quite interesting to know why.
Yes.
Because of certain medications, your body doesn't respond to the treatment. So the treatment is a natural... Well, tell us. I'm just very interested, because I haven't heard of this before.
Right. So biofiller is when you take blood, some person's blood, and then you spin it down into the centrifuge, and then it separates the plasma from all the other cells, like red blood cells and white blood cells. So it's the plasma portion of it. We draw off a portion of that plasma, and then we heat it up. And it's when you heat up plasma, it's like boiling an egg. The white of the egg starts off very runny, and then it gets harder. So the plasma is heated up to about 80 to 100 degrees for about 10 minutes, and it goes from a nice straw-coloured liquid to a cloudy, sort of coagulated, thickened product. And that we mix in some platelet-rich plasma into the filler, and then we inject it like a dermal filler. So it will give you a little bit of volume. And also, because it's got the PRP in it, it's got the platelets in it, which has growth factors in there, it can improve your skin quality as well.
Wow.
Yeah.
Often when I hear about these things, I think, who the hell decided that they were going to take the plasma out and warm it up?
I know,
Yes.
brilliant. Isn't it?
Yes, exactly.
How did you hear about this, Libby? I mean, is it something that a lot of people are doing, or is it quite unique to you?
No, there's more and more people becoming aware of it.
Yes.
So I came across it 2 years ago. I was doing some education with PRP, and this course had an added component of the biofiller. So the reason why I was going on that training is because a colleague of mine said, come on, let's learn about PRP. And I said, oh, that stuff doesn't work. So I went to the training and went, now I understand why I thought it didn't work. This gentleman was such a good educator and knows so much about PRP and regenerative medicine. And it was Ansar Mahmood in Stafford. And he was really, I mean, if you want to know about regenerative medicine, he's the man to go to.
Wow.
Fantastic, absolutely. So how long does it actually take before you start seeing those visible results after having it?
So you see, the results you see immediately are from the volumization, because as we know, when we lose volume on our face, we start seeing lines and wrinkles. So as you're replacing the volumes, the lines and wrinkles look immediately softer. But it does take up to about 2 to 3 months for it to really sort of start to set in. But the biofiller treatment program is you have your first treatment and then you have another treatment 2 months after it to make it last the year. So whilst you're immediately seeing skin quality improvements, you sort of start seeing further improvements.
So is it just injected with the little injections or cannulas? How does it?
No, it's injected. You can inject it with needle or cannula. So most of the time, so when Dee saw the procedure, I used a cannula. And I do understand that Dee thought, oh, it looked really rough. But actually, the patient looked normal straight afterwards.
Yeah.
Yeah.
Very little downtime, if any.
Yes. So you could go back to work. But there's always a chance of bruising.
Yeah.
Yeah, of course.
Always a chance. But we try not.
And how long does it take for the whole thing to work?
For the procedure?
Yeah. To work. I mean, the actual outcome.
Oh, the outcome. I would say after your second treatment, a month after that, you will start seeing a lot more difference in your skin.
That's interesting.
Yeah.
And what's the sort of skincare that you like the best, personally?
Personally, skincare. Well, that's an interesting question.
It is. I've always asked that because I think so many people, there's so much stuff, and I think we are bombarded, especially with things that look so pretty. Like, I mean, just we're girlies, and we think, oh, that looks nice.
Packaging.
Pretty box.
Yes.
What do you like the best? What's most surprised you? I suppose.
Right. So my favourite skin brand at the moment is ProXN. So it's a Polish brand. It's very niche, and the hero ingredient is xanthihumol.
Oh, they strike.
Exactly.
These things.
So, and guess where it comes from?
Wow.
Hops from beer.
Oh, so
make
just
beer.
beer on your face. Before it was fish face, isn't it?
Yeah, now it's beer
now
face.
it's beer face.
I think you'd have to put a lot of beer on your face.
Yeah.
So we've known about it for a long time, but it's been very hard to apply it to the skin without it causing ill effects.
What, drunken skin?
Yes, exactly. So this Polish people have found out that you encase it in cyclodextrin, and then as soon as it hits the skin, it's released into the skin. And it's one of the only ingredients that helps to reduce inflammation from the surface down. So it's very anti-aging and anti-inflammatory. So, and I think there's about 15 products in the range, so it's not a big range, so don't get confused. And it helps to improve the barrier function and also help with dryness, pigmentation, acne, rosacea, eczema.
And do you use this? Can you use this in conjunction with your treatment?
Absolutely.
Yeah.
Yeah.
Do you recommend that?
Absolutely.
Do you actually say that we should change our lifestyle with the treatment? I mean, do you recommend any big sort of change or little changes?
So, changes that you could make that are easy changes, easy wins, is cut down on your alcohol. I know.
Sorry.
No seed oils, and try and cut down on your processed food and just eat food, single ingredient food that you make at home.
Right.
That's going to make the best difference to your treatment outcome.
Yeah.
Yeah. And a bit of exercise thrown in.
And what about the future for you, Libby? What are you aiming towards now? Are you aiming to do this in a much as it develops, or are you looking at different treatments?
So I'm wanting to develop this biofiller because I'm really interested in regenerative medicine, as most people are today. So helping your body to improve itself by just giving it a few key ingredients to actually improve it. And I've probably started my career with a lot of Botox and filler, and now I'm going more to skin quality improvement with a small amount of volume.
Because a lot of people have, don't they? They have, always think about this, they have treatments, they have their faces lifted, but their skin looks awful.
Yes.
So, and also, you know, I was brought into, if you like, to be interested in this industry by a facialists. So the skin was always the most important.
Absolutely.
Yeah.
And it is. And as injectors, I think in the beginning, we were taught to just put lots and lots of filler in. But because I'm interested in skin as well, I'm sort of really veering towards skin and skin quality improvement. So I have had people that are on heart medication, medication for their kidneys, and on steroids and things like that, and they're just not going to respond very well to the treatment. So for those people, injectables I don't think are a great idea. I think it's more focusing on getting well and reducing the inflammation in their body. Yeah. I think that's going to be the best thing for them. Yes. And then maybe a facial. Yeah, to make their skin, but I think more it's from the inside out, really.
Yeah.
From the inside out is always good.
Yeah.
We've talked a lot in the past about polynucleotides.
Yes.
I just think that there's somebody sitting in an office somewhere who you say to, can you just come out with the most ridiculous name
I know.
for this treatment?
Polynucleotides.
Yes. It took me ages to
actually pronounce it.
Yeah, I know. Yeah.
And the other ones that you were saying today, I mean, I think what happens to the normal consumer, which is who we are,
yes,
is that, you know, we hear all these things and we're just like,
What's that?
What's that? You know, kind of what we want to know is what works.
What works? So yes. So it's really interesting. It all depends on your expectation for treatment. So if some people are happy with a small improvement, like, for instance, talking about polynucleotides. I had a wonderful client and I said, look, you need 3 treatments, 1 month apart, and then it will help to improve. And then ongoing treatment is you have 1 treatment every 6 months just to keep it going. And she came in and she said, Libby, I was nearly not coming in. She said, I was so chuffed. And all it was around her eyes, and her eyes were less crepey. And she said for her, it just made all the difference. When she put a makeup on, everything was a lot smoother, so that was her.
Brilliant.
So that works for her. Someone else who's got quite a high expectation, we have to be mindful with those people that we can meet their expectation or their expectation is realistic.
Yeah. With my
Sometimes it's
experience, with polynucleotides, is that my eyes didn't like them at all. I came out in tiny little sort of like bumps, and it lasted for ages. I looked like somebody who'd gone boof, boof, and I thought, and that wasn't EastEnders. Boof, boof. But it was really, really awful, and I thought, and I have not seen the benefits. So. Not that I was looking for any... I didn't even know what to expect, but I didn't like all the little bumpies under my eyes.
So there are different techniques of applying these products. So there was a certain time when they were saying if you don't inject into the polynucleotides and use the cannula, which I mostly do, they said it's not going to work. Then they did a split-face study, one side injected with point-by-point needle, one cannula. Guess what the results were?
Cannula better.
They both worked.
They both equally.
Yes. So for me, if my patient says, I'm going out to lunch, I don't want any bruising, and you're going, oh, gosh, I always use the cannula.
Yeah.
Some people, if they say, oh, I don't mind a bruise or two, don't mind a lump and a bump, I'll have the needles. So I always inform my patients and say, this is a cannula or needle, both work. What are you doing for the next 2 weeks?
Because I didn't really expect anything or know anything.
Exactly.
And I always say to everyone who has treatments, when they say, oh, there's going to be no bruising, I said, you shouldn't say that because you never know. But what I didn't expect was the bumps.
Yes.
And I think that's what surprised me the most. I mean, everything to me is a miracle anyway. If it works, it works.
Great.
And if it doesn't, it kind of doesn't.
Yeah.
And it's a miracle. But anyway, where can we find you, Libby?
So I work in Harley Street in London, and I'm there 3 days a week.
And the name of your clinic?
It's Libbie Wallace Skin Clinic.
Libby Wallace.
Brilliant.
So go to Libby and get these, what is it called again?
Biofiller.
Get some biofiller.
Biofiller.
And some polynuclear what's-its.
Oh, yeah, absolutely, 100%.
That too.
Oh, thank you, Libby.
Thank you.